We've been focusing today's daytime discussions on the complex issues of chronic brain injuries. Each injury is vastly different, as are the long-term impacts they can have on people's lives. In this segment, we're exploring the brain trauma endured by survivors of domestic and sexual violence. We have Julianna Nemeth with OSU's College of Public Health and Chronic Brain Injury Program, working alongside Rachel Ramirez at the Ohio Domestic Violence Network. Ladies, thanks for being here. Thanks for talking. This is a highly important topic to discuss today. So thanks for being here.
Yeah, absolutely.
Julianna, let's talk too about your partnership. This is multifaceted, I would say, with far-reaching goals, but goals that need to be set, of course. Explain for us first how brain injury is related then to domestic violence, to sexual violence.
Sure. So we know that sexual and domestic violence is far more than physical violence, but when people are targeted for that kind of violence, oftentimes the head and neck are the primary targets. And traumatic brain injury can happen when the brain is jolted, either through shaking or blunt force head trauma. And we also know that a different kind of brain injury can occur through oxygen deprivation. So strangulation, suffocation, choking can actually lead to hypoxic and anoxic injuries. And we're finding, our research here in Ohio in community partnership is really suggesting that 8 in 10 survivors in our domestic violence service programs across the state have been exposed to both blunt force head trauma and strangulation. And it's not really being addressed. It's not something that's been talked about in public discourse. It's not something that we've been studying in research or in clinical response.
What happens when that is left untreated, undiagnosed in a victim?
Brain injury can lead to physical symptoms, things like balance problems, seizures, headaches, things like that. It can lead to emotional problems, irritability, anger and rage, behavioral issues like substance use over the course of a lifetime. And I think one of the most important things is these have impacts on cognitive functioning. So what this leads to, if it's unaddressed, is survivors of violence really not having access to the health and safety services that they need.
You want to develop screening and care for survivors. So tell us what that would look like, Rachel.
Well, we at the Ohio Domestic Violence Network work with 76 local programs across the state of Ohio that provide direct domestic violence services. I think one of the things that's really important is preparing anybody who works with a domestic violence survivor that this could be a possibility and that this could be impacting, as Dr. Nemeth said, could be impacting their access to getting services, but also can make them living their daily lives hard. It can make taking care of children challenging. It can make doing all of the errands and all of the things that all of us need to do every day. Recognizing that all of those are brain functions, and when your head has been hurt over and over and your brain has been hurt over and over, those things might be harder for you to do.
So what's happening at the state level? Are there things being pursued to try to have more focus on this?
At the Ohio Domestic Violence Network, we established a Center for Partner-Inflicted Brain Injury, which really is providing leadership both within Ohio and really nationally and internationally. We have a website at ODVN.org. We have a page that has educational resources for survivors, tools for professionals, online learning courses that can really help everybody learn a little bit more.
We actually developed in partnership with local organizations an intervention called CARE. CARE actually raises the capacity of domestic violence service organizations to provide trauma-informed care in general, because advocates feel empowered to address head trauma and strangulation in a way that they didn't before. By putting brain injury on the table in terms of the very complex things that survivors are dealing with, advocates are then able to provide functional support and provide accommodations. So the other thing that we're doing at Ohio State in partnership with the community is really building pathways to health care for survivors that really recognize the very, very complex circumstances in which they're living and really support community partners that really know nothing about brain injury in terms of how it is that they can provide better supports and pathways into health care and supporting the social determinants of health as well. So we are doing everything we can to shed light on this issue and to really develop the science that's needed, but in a way that's informed by the community.
And I think you said a couple key words there. Recognition, knowing that this is out there and it exists. It's a problem is amazing that you guys are doing that, raising awareness about it, and then actually going forth and providing support to these survivors. So 2 amazing things. I'm so glad you guys were here to share it with us, and thank you for being here in our community.
Thank you so much.
Thank you so much.
And that awareness of brain injury is a vital part of this puzzle. Up next, we're going to delve into the snowball effect a bit of not having your full cognition, right? As the struggles for survivors can add up quickly. And the sponsor of that previous segment, OSU's Chronic Brain Injury Program.